Hello viewer, this is it, and this is Havana, Cuba at night. Of course, there's a 7-hour difference between Nairobi and Havana, the capital of this country called Cuba in Latin America. But then again, the biggest news today, of course, like we've been telling you, the Cabinet Secretary for Health, Sicily Kariuki, has been in Cuba, of course, leading a high-power delegation to Cuba on a benchmarking tour, but also to attend a health conference convened by the Cuban government. But the biggest news as it is, when the president was here in the month of March, there was a deal that was signed that would allow 100 specialist doctors from Cuba to come to Kenya to spruce up the number of doctors in Kenya, but most importantly, provide specialist services, the missing gaps or the missing link in the Kenyan healthcare system, and that will happen. The good news is by June or the end of June, the doctors should be arriving in the country. The signing of this particular deal or the final details of this deal will be signed tomorrow here by the Cabinet Secretary Sicily Kariuki and her counterpart from the Cuban government. There will be 100 doctors, but of course this will also allow 50 doctors from Kenya to come to Cuba for training on this very same issues in terms of being specialist doctors, because as you well know, there is a shortage of doctors when it comes to the field of dermatology as well as neurology and other areas of surgery, and the doctors will be coming to spruce up the numbers. And here is the Cabinet Secretary Health on this matter.
We do not have sufficient specialized doctors across the country, but even where we have a skill set that is required to go to the far-flung areas, we also have cases of human resource being asked to serve in the far-flung areas, but not willingly going to serve in those places. And so the specialized doctors who we are bringing today is really a drop in the ocean of what we may require. But it's a starting point. We'll invest in it, but we'll invest in it with the aim of using them to train and capacity build and also mentor our own doctors.
One would ask, since there is opposition from the Kenya Medical Practitioners and Dentists Union on the aspect of engaging Cuban doctors, what would be the position of county governors, bearing in mind that they're also a critical player since health is a devolved function? Here is Governor Mohamed Kuti of Isiolo, the chairperson of a subcommittee on health at the Governor's Summit.
I want this to be taken in a very, very sober way, because Cuban doctors are not coming to replace Kenyan doctors. We will always need Kenyan doctors. We will continue training the Kenyan doctors. We will continue strengthening our local capacity. We are not going to replace anybody. But we have to also accept our situation, number one, of the national doctor-patient ratio. We have also to appreciate the fact that certain counties lack specialties.
But of course, the other benefit that Kenya is likely to reap from this tour by the Cabinet Secretary to Cuba is on the eradication of malaria. You well know that Cuba was able to eradicate malaria in 1960, and the vector control is one of the deals signed by the Cabinet Secretary this morning, as well as on the areas of cooperation in agriculture, increasing sugarcane production, as well as the provision of biofertilizers and biopesticides. And the deal was signed today by the Cabinet Secretary for Health, Sicily Kariuki, of course, on some bits on behalf of the Cabinet Secretary for Agriculture, Mwangi Kiunjori. That's it for now, but of course we'll keep updating you on the happenings here in Cuba. My name is John Jacob Curia.